What is going on with Donald Trump's health? Why did he go get another MRI, an undisclosed one, an MRI scan during a recent trip to Walter Reed National Military Medical Center? The first time that he has provided a reason for his second medical exam this year and raising new questions about the president's health. Let's discuss. Dr. Frita is a triple board certified medical doctor with certifications in nephrology, hypertension, and diabetes. She's also the host of the very popular Dr. Frita YouTube channel. Dr. Frita, thank you so much for joining. So now what is going on? It's his annual checkup, but he goes twice. Like what's up with this?
Yes, Don, there's something that's going on that's not normal. So yes, when we first heard that he had a second annual checkup, we all knew that didn't make sense. Who goes for a second once a year checkup? And then he shared certain things like he had his flu vaccine, his COVID vaccine. And so that's what I was harping on initially, because there's so much anti-vax rhetoric coming out of the White House, yet watch what people do, not just listen to what they say. So I was on that, but then I'm like, the White House has so much access that you can get just about anything done in the privacy of the White House. And so for him to have gone to the actual hospital, knew something was up. An MRI. You don't just do MRIs for no reason. That's just not a routine screening. So for him to have an MRI, there is something going on that the doctors are worried about. They're suspicious of it, and it's concerning enough for him to have him to leave to do the MRI. And so in a 79-year-old man, many things can be going on, but I'll just say, Don, for him to come out and say, it was perfect. They said it was the best they've seen at anyone my age. That is just highly unlikely and very much unbelievable. So here's what I'm thinking as a physician, as I think about this critically, while looking at what we've observed, everyone has observed with President Donald Trump. MRI. So I don't know where they did the MRI, but let's just start with the brain. If you do an MRI of the brain in a 79-year-old, with Trump specifically, it's been observed that he has forgetfulness. Sometimes he has what we call confabulation, where you're just speaking and kind of babbling, and it's not necessarily making sense or with the initial train of thought. So he has, in my observations, experienced some type of a confabulation where he's just kind of putting some words together, and sometimes he mumbles words incoherently. Also, he will sometimes confuse people. I think we've seen him confuse Nikki Haley with Nancy Pelosi. We've seen him think that he ran against President Obama, things of that nature, and not just once or twice. And he's repeated these things enough to make it be like, that's a little concerning. And then when he quotes like statistics and numbers of jobless people, or how many lives have been saved by him as far as opioids, or how many people he's kept from being taken away from undocumented immigrants, he'll actually give specific numbers that are in the thousands, and from one speech to the next, they'll be very different. And so one might conclude that there is some type of a mental decline, right, in President Trump. So these are some observations that are just, being made. And then even if you watch him when he gets off of Air Force One and he's walking down the red carpet, he oftentimes does not walk in a straight line, right? He doesn't have a steady gait. He'll kind of walk from one side to another. So an abnormal gait is something that I've observed with him, and the rest of the world has observed. So that makes me think,
Yeah, we noticed that when he went to greet Putin, remember at that Putin summit that they had, I think it was in Anchorage, right, in Alaska. And he was like walking, which is bizarre.
Yes.
We have never talked about that, Dr. Frita. That's, what's going on?
Yes, it's bizarre unless you have some type of a neurological diagnosis to explain it. Now, because he's on the world stage, the largest world stage, arguably, we all see these things, we all observe them. And so if we're seeing them, then certainly his medical doctors are seeing them as well. And so it is highly likely that he had a brain MRI to assess for what could cause some of these neurological changes. Dementia could do it, such as Alzheimer's, or any other type of a neurological disorder that affects your cognition. A brain tumor could do it. If he had a brain tumor in a place that affects your motor skills, that affects your speech, that affects your ability to understand speech, that could do it as well. Also, if he were to have some type of an increase in the pressure in his brain, like a brain bleed, a stroke. So, of course, we don't know what his diagnoses are. But when I think about why a person would have an MRI, these are very likely, probabilities or possibilities of why a doctor would do an MRI on the brain.
I'm so glad that you said that, because you haven't treated him. You're just saying the possibilities are when people get an MRI at someone who is 79 and the oldest president in U.S. history, one of the oldest. He said he had an MRI, but then declined to tell reporters about exactly what it was for. And he said, ask the doctors.
Right. He usually has no problem, explaining, like when he passed the mini mental status exam, which is a very, very simple exam for people who have proper cognition. And he told us that he had a perfect score. He has no problem going into detail. But for him to say, ask the doctors, that's also suspicious, almost like I dare them to say something,
Well,
Yeah.
Well, doctors, Caroline Levitt was asked about it in a press briefing, and asked about at least advanced imaging. Didn't give much of an answer, and it sounded like she had no idea what she was talking about. Watch. I want to hear what you have to say.
Any more details on the president's Walter Reed visit? The readout from his doctor mentioned advanced imaging. What procedure was he referring to?
Advanced imaging is something that presidents receive and people receive when they go to the doctor. And so we provide a detailed readout of that physical, and I would encourage you back to that. Presidents and I don't know the exact imaging that took place, but as the physician's note said, the president is in incredibly good shape, and I think that's evidenced here every single day.
In very good shape, and such as this is what happens when people go to the doctor, they get these. What do you say to that?
That was a garbage answer. Yes, advanced imaging is not something that presidents get. It's something that individuals get when there is a specific concern, when there is some type of an abnormal pathology going on in behavior or in physical exam. It is not routine, as she suggests. And something else, Don. Now, as we observe Trump, if you pay attention to his pants, then I know specifically, I'm a nephrologist, right? So I'm a kidney doctor. I deal with Foley catheters, which are catheters that are placed into the bladder. And oftentimes when my patients have certain illnesses, they go home and we leave their Foley catheters in, to collect the urine. The urine is collected in the bag. The bag is something like, it depends. It might be 6 inches, it might be 10 inches. And when it fills with urine, and they have the bag attached to their thighs under the pants, you can actually see kind of a square bulge in the thigh of the pants. Again, I'm not Trump's treating physician by any means. I do not know any more of his history than the rest of the world of what they've presented. But I will just say, as an observation from a physician who places Foley catheters, who has patients, sometimes if you just pay attention to the footage, you'll see that he'll have a bulge in the thigh of his pants. And it oftentimes looks like it could be consistent with a Foley catheter bag. This is just an observation. If that were the case, speaking hypothetically, then you would be concerned, does he have some type of a blockage that's keeping his urine from flowing? And a very common blockage that older men get is a large prostate, BPH, benign prostatic hyperplasia. This is just speaking, statistically speaking, in older men, what they can get. If that happens, then oftentimes we do put in a Foley catheter, a tube that goes into the bladder, and the fluid is collected in the leg, and it's not a perfect science. And so you can see the bulge in the pants. Other things that can happen if you have a large prostate, you can get elevated prostate enzymes, or PSA, prostate specific antigen. If this happens, then you must be suspicious for, if there's a high PSA, then could there be prostate cancer, which is the second most common cancer among men and second leading cause of cancer death. Again, I don't know anything more than we know about Trump's history, so I'm not speaking on him specifically. That is another reason why a man could have an MRI. Doing an MRI of the prostate could assess to see if there's some type of a prostate cancer. So we're just talking about possibilities on why someone would get an MRI, because again, it's not just routine run-of-the-mill to get
Yeah.
an MRI for no
And,
reason.
and maybe they don't want to know if it's prostate. They think it's, oh, that's just a little too personal for the president. But also, I mean, it has been reported and some have speculated that, maybe he has adult diapers as well. Have you seen any evidence of that? Because
just in the way that his pants are fitting. And of course, it's not an exact science when you observe, but we observe him quite a bit. And we know what men look like when they're walking with their nicely fit suits versus when there's a bulge that's not typical. And so by bulge with him, it could be consistent with the diaper or a Foley catheter. We don't know, but the observation, leads me to think that that's a possibility. So brain MRI, prostate MRI, whatever the cause, is not routine. And I'm quite sure that his MRI would not have been perfect at the age of 79.
Something that you and I talked about this summer, the White House announced that, well, first of all, before that, before we go to that, about his other illnesses, this was Donald Trump talking about the MRI on the plane.
The readout from Walter Reed mentioned advanced medical imaging. Did you get an MRI? Can you tell us what that was?
I did. I got an MRI. It was perfect. Yeah. I mean, I gave you the full results. We had an MRI, and in the machine, the whole thing, and it was perfect. Yeah.
Did you say what in particular?
You could ask the doctors. In fact, we have doctors traveling with us, but I think they gave you a very conclusive. Nobody has ever given you reports like I gave you. And if I didn't think it was going to be good, either I would let you know negatively. I wouldn't run. I'd do something. But the doctor said some of the best reports for the age, some of the best reports they've ever seen.
You put your head in your hand. Why?
Because he doesn't even try to make the lies believable. That's the part that just gets me now. In the beginning, I used to just be like, oh, did you hear him? Can you believe he said that? Now it's just like, what are you talking about? I mean, we've had presidents like President Obama, even President Biden. Yes, he was, very advanced in age. He is very advanced in age, but just as far as his, physicality, his being lean, his being active, we've had so many presidents who are in better physical shape, yet he's got the best physical health that we've ever seen. And then the height that he reported on that exam, 6'2" and 220 something pounds. We have eyes that work, and it's not true. So I'm just frustrated that he is able to just tell untruths with impunity, and everyone sits around like we don't have common sense. It doesn't take a medical degree to know that it is unlikely that he had a perfect MRI. It also doesn't take a medical degree to know that those MDs, if they wanted us to see how perfect his MRI was, they would show it. And tell you we would jump on those MRIs like white on rice and start breaking them down. They know it.
They know it. They don't want you to see it. You mentioned him talking about cognitive abilities, and he went on this rant about AOC and cognitive abilities. I don't. Okay, here it is. You play it. Now I want you to respond.
They have Jasmine Crockett, a low IQ person. They have AOC's low IQ. You give her an IQ test, have her pass like the exams that I decided to take when I was at Walter Reed. Those are very hard. They're really aptitude tests, I guess, in a certain way, but they're cognitive tests. Let AOC go against Trump. Let Jasmine go against Trump. I don't think Jasmine, the first couple of questions are easy. A tiger, an elephant, a giraffe, When you get up to about 5 or 6, and then when you get up to 10 and 20 and 25, they couldn't come close to answering any of those questions.
Okay. Yes, ma'am.
Why are y'all playing with me this morning? We're not talking about them taking the bar exam. We're not talking about them taking the MCAT or LSAT or anything. We're talking, do you know the questions that they ask in this test that he's talking about, going against Black and brown women, comparing himself? They're asking things like spell world backwards, count backwards, from sevens. They're asking you to say, if you say ball, phone, cat, they'll come back in 5 minutes for you to remember those 3 words. This is the cognitive test that he's speaking of, that he wants these young, highly intelligent, highly accomplished women. He wants to compete against them. Oh gosh. He should go ask his head of the Department of War to take the test against him if he really wants to have some equal competition.
Or compare their education and his to, I'm just going to read Jasmine Crockett here, okay? Jasmine Crockett attended Mary Institute of St. Louis Country Day School, the Rosati Kane Academy, a private all-girls Catholic high school in St. Louis. She attended Rhodes College. She was advised by a professor that she had too much personality to settle for her plan to become a certified public accountant. And then she went on to go to law school. She worked for the Corcoran firm. She graduated with a Bachelor of Arts in Business Administration, and then began her law school at Thurgood Marshall School of Law, Texas Southern University, before graduating from the University of Houston Law Center with a Juris Doctorate, and soon passed the bar examination. She's a member of the National Bar Association and the Dallas Black Criminal Bar Association. That doesn't strike me as someone who has a low IQ.
Not exactly. Not exactly. And what's really crazy is even without you reading that impeccable resume, anyone who just watches her and listens to her quick wit, you know that she is well above what Trump could ever dream of being as far as his intelligence. And AOC is right there. So the fact that he feels very comfortable saying that Black women and Latina women have low, he says it as if it is a fact. It just lets you know how he just really needs to be disabused. It's almost laughable.
And Marco Rubio is standing behind him laughing. Is like, Marco Rubio, come on, man. You're better than that. You're laughing at a brown woman, a brown man. Let's talk about something that we talked about. I mentioned earlier. This summer, the White House announced that Trump was examined for his swelling legs, his ankles or cankles, that he was diagnosed with chronic venous insufficiency. It's venous insufficiency is a condition in which valves inside certain veins don't work right the way that they should. And then also the discoloration on his hands. Remember, we talked about all of that. How does that play into any of this?
Well, it could. And I'll tell you, if he were to have something, again, of course, we don't know, I'm just speculating. If he were to have something that were more serious, like a malignancy, a cancer, it could cause you to have a hypercoagulable state, meaning it could increase your risk for having blood clots. If you had a high risk for blood clots, that would mean that you would recommend to then take blood thinners. If you had blood thinners, then that could cause easy bruising to the hands. Having a hypercoagulable state could also increase your risk for having blood clots in the legs, which could cause swelling. So as I kind of go through and I'm always thinking about what's the differential diagnosis, that's how my brain takes it all back to what could take you to possibly having an MRI to look for a source of malignancy or cancer. Again, we don't know, but I will say that the explanation that they've given for his leg swelling is just about the only benign cause of leg swelling. And how convenient is that? Of all the things that can be life-threatening, like a deep vein thrombosis or peripheral artery disease or peripheral vascular disease or something that could lead to potential amputations, of all of those different things that can cause leg swelling, he happens to have the one very common benign problem. Is it possible? Of course. As far as the handshaking, he is not the first president in history to do a lot of handshaking. So why is he the first one who's having this quite severe discoloration, hyperpigmentation, what appears to be bruising in his hands, so much so that they've gone out and grabbed them some Fenty matte CoverGirl makeup to cover it up. And he's like, oh yeah, a lot of handshaking. Did the other presidents not shake hands?
That's the wrong side of the hand, by the way, but go on.
Oh, God. Right. Like who is like any, it just doesn't, well, Melania slaps him on that side sometimes when he's trying to hold her hand, but it's just, again, we don't know any more than what has been revealed, but every time they say that they're very transparent, it just doesn't seem so. Objectively observing as a physician and just going based on my life's experience and the different patients I've had who are 79-year-olds who have these symptoms, who've gone for a second annual examination and who've had MRIs, it's just highly unlikely that he has a benign presentation, as he's saying. Time will tell, because certain illnesses can't hide forever, especially when you're in the public eye like he's in.
Thank you, Dr. Frita.
My pleasure.
Thanks everyone for watching. Your support means the world to us. So make sure you hit the like button and you subscribe to our channel to make sure that you never ever miss a video. We're live every day, 10 a.m. Eastern time. We drop even more content at 2 p.m. Eastern and 5 p.m. Eastern. And if you want more Don Lemon Show content, we'd love for you to become a member of the Lemon community, where you will receive access to special community posts. You'll get exclusive content and members-only live shows. So head over to our channel page or click the join button on this video. Again, thank you for watching. We appreciate your love and your support, and we will see you next time.